Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
On today's episode, Paul, we're talking about how long do I have to stay in the hospital when I get my hip or knee replaced?
Hot topic.
Hot topic.
Because some of our older videos, older, I mean like 2 or 3 years old, not even that old.
Not that old.
We talk about staying in hospital for 3 days, 4 days, 5 days after a joint replacement.
Yep. I would say I've been in practice for 13 years now, and I used to always tell people 5 days, and then it's gradually gone way, way down for a host of reasons.
Yes. What are some of those reasons why? Length of stay, it's not your imagination. The length of stay after a total joint replacement is decreasing. By length of stay, we mean how long you stay in the hospital after the surgery.
How many sleeps?
How many sleeps in the hospital? That length of time is decreasing.
What do you tell your patients is average nowadays?
Average, well, the average I think in our area where we work is about 2.3, 2.4 days, something like that.
Right.
So I tell people now you're going to be in the hospital for basically 1 or 2 days, I say.
Yeah, I'd say most of my patients are going home on day 1 or day 2, and I've had a couple in 13 years go home the same day, but that is exceedingly rare.
Exceedingly rare, however, there are some centers that are boasting or advertising or releasing to the media that they are doing same-day surgery or going home within 24 hours of hip or knee replacement.
Okay, so let's talk about first why are we able to get people home sooner than we were 10 years ago?
Okay, so there have been some advances,
okay.
Specifically in the way we do the anesthetic.
Yes.
Okay, so now we're able to do them more under what's called regional anesthetic. You can check out some of our other videos that describe what that is. So regional anesthetic, so you don't have a full-on general anesthetic. That's one reason.
I'd say the other reason is probably the use of nerve blocks, so better early pain control, so like an adductor block for a knee replacement, something to reduce the pain but doesn't make you drowsy or feel sick to your stomach.
And we've made some advances in pain control, multimodal pain control, because previously people would be in the hospital requiring intravenous pain medication to help manage their pain after surgery. Now we have multimodal oral agents that we can give you that control your pain, so that can get you home quicker as well.
And I think along the same vein, no pun intended, we're using a lot less narcotics. Narcotics are good at pain control, but they have a lot of other negative side effects, like making you feel drowsy or sleepy or sick to your stomach. So we've tried to trend away from reliance on narcotics, using things like anti-inflammatories, Tylenol, and other things. So that's been a big difference.
And I mean, one thing we have to give credit to, it's not really, I mean, I don't do anything different really with the surgery, not much different.
I would agree.
It's really, we're blessed here with an amazing nursing staff, physiotherapy staff, pharmacy team, and pain control team that get involved, and all these people and discharge planners, they all get involved very early to start to get a patient home as quick as possible.
I think the other thing too is that people, this is discussed with them ahead of time.
Right.
So what people expect or what they plan for is better. So before, if you were told you're going home day 5 and then on day 2 someone says, hey Paul, you're going home today, and you're like, well, my bags aren't packed, my house isn't ready, I don't have a walker, my aunt was picking me up, like there's like 50 obstacles. So now people are just planning on earlier discharge.
Okay, and now what does that mean for the patient? Is it harmful to the patient to send them home so early?
So I think the perception of patients is that it definitely is. However, I would say no, it's not. So our main goal for discharge is that you have to be safe and relatively independent before you can go home. And sometimes that's day 1 and sometimes that's day 9. But no, definitely it's not unsafe for the patient.
Okay, in some ways it is better to go home. One thing that we talk about a lot is infection. In the hospital there are a lot of antibiotics being used, so there's a lot of bacteria that become resistant to antibiotics, and you can get, I would say, a worse kind of infection with a worse kind of bacteria while you're in the hospital than if you go home. So we worry about keeping you in the hospital, ironically enough, but we don't want you to get a bad infection with one of these.
Having said that, thankfully that's really uncommon, but I totally agree. Hospitals are not dirty places, but they do grow bacteria that are stronger than out in the normal environment, for sure.
And another advantage of getting home is because it's better for you after a joint replacement to get up and move around. And in the hospital, there's a tendency more to not move around and to stay bedridden because you have a lot of stuff done for you. But if we get you home quicker, that gets you mobilized quicker, which is safer because it reduces your risks of pneumonia, it reduces your risks of blood clot, DVT, PE, that kind of stuff.
I tell my older patients too, it's more familiar. So you're in your own bed, you're eating your own food, you're in your own chair. Like it feels more familiar for people.
Yeah. Okay.
Now, why are people trying to get out sooner? Like, why do hospitals care about that?
That's a loaded, complicated question that I don't pretend to know the answer to. But
part of it's obvious, though.
Money. At the end of the day, it's expensive to stay in the hospital. Okay, so no matter where you're having your joint replaced, what country, wherever you are, money's going to be a factor because depending on whoever's paying for this joint replacement. So
right. In Canada, we have socialized healthcare. So if we can keep the quality of service the same but reduce the cost, that's better for everybody because we can provide more services. Okay.
And in other parts of the world, you have insurance companies paying, or HMOs,
or you're paying out of your pocket.
So money is a factor. I think that we have to discuss as well. Sure.
And I think the other thing is that it allows us to do more surgery.
Yes.
Right? I think what patients don't realize when I say, okay, you've been approved to go home, and they're like, wow, can I stay 2 more days? I say, well, physically you could stay 2 more days, but if you do, then someone else might not be able to use your bed to get their joint replaced.
Yes. And now, having said that, we don't want to ever kick someone out of the hospital.
No.
I'm sorry if you've ever felt that way. But yeah, if you're unsafe to go home, and that's determined by professionals, physiotherapists, nurses, other physicians who are looking after your medical aspect of your care, we want to make sure that you're safe before you go home. What happens if you just can't do it? If you're elderly or you have other issues and you just can't go home on day 1 or 2?
So then you stay longer, and then the discharge planning team talks about whether or not you'd be a candidate for just a couple more days on a regular ward, whether you'd be transferred to a rehab ward if there was availability, or possibly to either a rehab hospital or what's called a respite hospital, almost like a temporary nursing home, which a lot of our patients will arrange ahead of time.
Yes, you can arrange that ahead of time to have a place to go to convalesce.
Yes.
Or otherwise, the team will try and arrange some things to come to your house, a physio to come to your house, a PSW to come to your house, or some resources that you might need at home to enable you to get home.
Yeah, and the amount of resources that are available in those situations certainly is very variable. Whether you'd have to pay for it, or your insurance would pay for it, or the government would pay for it, there's a lot of different factors involved.
So where is this going? We were at 5 days, then we went to 3 days, 2 days, 1 day.
So I guess, so like you said, theoretically some people could go home the same day. Do you think that's a practical option for most people, Paul?
Personally, I'm not a big fan of sending people home the same day. I think the places that do it have a lot of resources in place. Someone's phoning you at the home the next day, maybe a visit from a nurse the next day, or a clinic that you can go to the next day. There's a lot involved in getting someone home the same day. And personally, I don't have the drive or urge to think, oh, I got to get my patients home the same day.
Yeah.
That's my own personal opinion. I think it's okay to spend a night or 2 in the hospital after a joint replacement. Who knows? Maybe I'm going to change my tune when we make our next video in a year or 2, saying, hey, we're coming to your house to replace your joints, clean the laundry room, we'll bring a tent.
And I would agree. I think the patient that is appropriate for that is very uncommon. So typically it has to be a younger patient who's more fit, who has resources at home. And so the 85-year-old guy that lives on his own and uses a walker and has a bunch of other medical problems is probably not appropriate to be sent home that afternoon with a suitcase and a kick in the pants.
Yeah, that's right. Or us to come to your house and replace your hip, or do it in a drive-through type setting.
Mobile surgery.
Bring a band to your thing. The drive-through works good for knees, not so good for hips. People have a hard time getting their hip out the window.
Yes. Anything else, Paul?
No, that's it. But it's not your imagination. Length of stay is getting shorter and shorter and shorter after joint replacement. Our older videos, we talk about 3 to 5 days. Just fast forward through that part, please.
Yeah.
The length of stay now, we're telling people you're staying in the hospital for 1 to 2 days after your joint replacement.
But know that you're getting everything that you require. You're not being kicked out too soon just to save money, because ultimately if you get sent home and then have to come back, that costs way more in the first place. So be prepared.
And if you do go home real early and you're worried about anything, then just come back in, come to Emerge and get, or phone the office, or if there's any other resource phone number that was given to you to phone to make sure everything's okay, that's fine too. But yeah, I don't think my complication rate hasn't gone up.
No.
Patients are doing better, I think, now than they used to do 5 years ago. So
I would totally agree.
it's not that we're not doing harm. It's still, you're still having successful outcomes, and you're just getting out of the hospital quicker.
So good luck with your total joint replacement. Enjoy your 1 or 2 night vacation in the hospital. And if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own health.
And kind of your length of stay. See you next time.